Gugudurata mo. Sino kayo? Ayoko. Ayoko. Oo nga pala. Idudura mo nga pala yung may curve basing. So remove all the jewelry in the portion of the Ano ba? Kasi nagrab ko na lang yun kasi di naman kita yung mukha ko. So hi, I'm Catherine and I'm going to be your aide today. So ngayon po magkakontak po tayo ng oral care.
Explain to the client and the family what we are going to do and why it is necessary, how the client can cooperate. So perform hand hygiene and observe other appropriate infection control procedures and provide privacy. Position the unconscious client in a side-lying position with the head of the bed lowered. Then assemble the equipment. So we have towel, curved basin, disposable gloves, bite block to hold the mouth open and teeth apart, toothbrush, cup of tepid water, dentifrice, tissue, denture container, mouthwash, rubber tip bulb syringe, suction, foam swabs, and lip moisturizer. Place the towel under the client's chin. So after wearing gloves, place the curved basin against the client's chin and lower cheek to receive the fluid from the mouth. Then brush the teeth, avoiding injury to gum. If dangerous presents, remove them, clean them, and replace them. Rinse the client's mouth by throwing about 10 ml of water or alcohol-free mouthwash into the syringe and injecting it gently into each side of the mouth. So wipe the patient's mouth using a tissue and remove the basin and dry around the client's mouth with a towel. Replace artificial dentures if indicated. Then after, remove and discard the gloves and sanitize your hands. And lastly, document the assessment of the teeth, tongue, gums, and oral mucosa and any problems such as sores or inflammation and swelling of the gums.
So before conducting oral care, we need to assess the following. So the extent of the client's self-care abilities, the client's usual mouth care procedures, and inspect gums, lips, oral muscles, and tongue.
Then assemble the equipment. We have towel, disposable gloves, curved basin, toothbrush, cup of tepid water, dentifrice, mouthwash, and dental floss for brushing and flossing.
Hi Mr. Christian, I'm Catherine and I'm going to be your aide today. So Mr. Christian, kahit po ba natin po? So Mr. Christian, ano po bang toothpaste ang gusto po natin?
So before the procedure, perform hand hygiene and observe other appropriate infection control procedures and provide privacy. Put on disposable gloves and moisten the bristles of the toothbrush with tepid water and apply the dentifrice to the toothbrush. Then after, hand the client the water cup or mouthwash to rinse their mouth. Then ask the client to spit the water and excess dentifrice into the basin. Repeat the preceding steps until the mouth is free of dentifrice and food particles. In flossing the teeth, wrap one end of the floss around the third finger of each hand. Move the floss up and down between the teeth, and when the floss reaches the gum line, gently slide the floss into the space between the gum and tooth. Then after, give the client tepid water or mouthwash to rinse the mouth and a curved basin in which to spit the water. And don't forget to assist the client in wiping their mouth. Remove and clean the curved basin, and remove and discard the gloves, and document the assessment of the teeth, tongue, gums, and oral mucosa. Therapeutic positions. The first position is the supine position. The patient lies on his back with his head and shoulders are slightly elevated. This is the usual position. The next one is the prone position. This position in which the patient lies on the abdomen with the head turned to one side with one small pillow under the ankle. The indication of this is post-operatively, for renal biopsy, patient with pressure sores, operation on the back, to relieve abdomen distension and to examine the back. The third position is the lateral position. The client lies on the side with weight on hip and shoulder, and the patient lies on his side with both arms forward and his knees and hips flexed. The upper leg is flexed more than the lower leg. The upper knee and hip should be at the same level. The indication of this are for taking rectal temperature, giving back care, for giving enema and colonic irrigation, and it is used for examination of perineum. The fourth position is the lithotomy position. The client lies supine with hips flexed. The legs are separated and thighs are flexed. Indications for lithotomy position are for delivery of baby, for rectal examinations and surgeries, and for vaginal examination and hysterectomy. The fifth position is the dorsal recumbent position. The patient lies on back, knees fully flexed, thighs flexed, and externally rotated feet flat on the bed. The indication of this, it is used for catheterization, vaginal vulval, vaginal, and rectal examination. It is also used for vaginal operations. The next is the Fowler's position. It is a sitting position in which the head is elevated at 45 degree to 60 degree and the client is slightly elevated, avoiding pressure on the popliteal vessels. There are three angles at Fowler's position, 30, 45, and 90. So the indications of this are to improve circulation, to relax the muscles of the abdomen, back, and thighs, and to relieve tension of abdominal stature. The next position is the Sims position. In this, the client lies on either the right or to left side. The lower arm behind the body arm is bent at the shoulder and elbow. The knees are both bent, with the uppermost leg more oculate bent. So the indication of this are for vaginal and rectal examination, administration of enema and suppository, orthopnic position, high Fowler's position with overbed table to place across the front of the patient. Patient rests both hands on overbed table or on pillow placing it and leans forward. The indications of this are patients with severe Nia, cardiac patient's position for thoracentesis and patient with chest drainage tube.
So hi, I am Catherine and I'll be performing post-mortem care. So before doing any procedure, let's do hand washing or sanitize our hands. Then after, wear gloves. So don't forget to talk to the patient's family or guardian if they have traditions or rituals to do, or they have cultural belief that they will perform before we can touch the body. Prepare all the equipment needed in the patient's room. So we have to strengthen the body, and always remember to put a pillow under the head. Remove all the jewelries, and if there is a specific order,
You may tape a wedding ring in a place and carefully document it.
so close the patient's mouth by putting a roll towel under the chin. So bat any part of the body that has been soiled with a discharge. Remove all the soiled dressings and replace it with new ones. So pat the wrists and ankles and tie them loosely together. If the patient's eyes aren't open, close it and place a small ice pack in each eye. So if the patient wears dentures or glasses, give it to the family as well. So remove all the extra equipment in the room. So remove the top linens except the sheet that covers the body. Then wrap the body before it is taken to the morgue. Bag should include name, address, diagnosis, and exact time of death of the patient. So after the procedure, remove gloves. Then sanitize our hands. And document the client's exact time and death.